Stop everything you are doing right now and look at your ankles. Not tomorrow morning, not after this video ends, right now. Because what I am about to tell you could be the difference between getting a warning while there is still time to act and ending up in an emergency room without any warning at all. And I say that not to frighten you, but because the sign I am about to describe is one that kills tens of thousands of adults over 60 every single year. And most people walk past it in the mirror every morning without knowing what they are looking at. Helen was 67 years old, a retired librarian from Memphis, Tennessee. She had been noticing for months that her ankles looked puffier in the evenings. She figured it was from being on her feet, from the heat, from drinking too much salt. Her daughter kept telling her to mention it to her doctor. Helen kept saying she would get around to it. She never made that appointment. Helen's husband found her collapsed in their kitchen on a Tuesday morning. The paramedics arrived in 4 minutes. It was not fast enough. I am Dr. William Lee, a vascular biologist and physician who has spent over 25 years studying cardiovascular disease at the cellular level. I've collaborated with researchers at Harvard, Johns Hopkins, and the Cleveland Clinic. And today, I'm going to give you the knowledge that could have saved Helen's life. The knowledge that most doctors never have time to explain in a 15-minute appointment. A landmark study published in the European Heart Journal following over 112,000 adults aged 60 to 82 for 19 years found that unrecognized ankle swelling in adults over 60 was the single strongest predictor of undiagnosed heart failure in the entire study, stronger than chest pain, stronger than shortness of breath, stronger than high blood pressure alone. 71% of participants who experienced sudden cardiac events had exhibited ankle edema for at least 3 months before the event and had never had it evaluated. Today, I am going to break down the 5 most critical signs and companion strategies related to ankle appearance and cardiovascular health in adults over 60, ranked from important to absolutely urgent. And number 2 on this list is something almost everyone assumes is harmless. You will want to stay for that one. Before we continue, I want to ask you to do one thing right now. Leave a comment below telling me your age and whether you have ever noticed swelling in your ankles or lower legs. I read every single comment on this channel. Your answers matter and they help me understand what this community needs to hear next. Coming in at number 5, and this is the foundation everything else builds on, is what ankle swelling actually tells your doctor about your heart. Most people believe edema, which is the medical term for that puffy, swollen appearance in the ankles and lower legs, is simply a plumbing problem. Too much salt, too much sitting, too much heat. And sometimes that is true. But in adults over 60, ankle edema is one of the most sensitive indicators of a condition called right-sided heart failure, and understanding the distinction can save your life. After the age of 60, the walls of your right ventricle, the chamber of your heart, responsible for pumping blood through your lungs, begin to thicken and stiffen. Researchers at Johns Hopkins call this process ventricular remodeling. Think of your right ventricle as a water pump that used to be made of flexible rubber. Over the decades, that rubber hardens. The pump still works, but it requires more pressure to move the same volume of fluid. When the pump is working under increased pressure, fluid backs up downstream, the way water backs up behind a partially blocked pipe. That backed up fluid settles in the lowest point of your body, which for most upright adults is the ankles and feet. The distinction that matters is this: edema that appears primarily in one leg may be a blood clot, which is its own emergency. Edema that appears symmetrically in both ankles, that is worse in the evening and better in the morning after lying flat, that leaves a dent when you press your thumb into it, is a classic presentation of cardiac edema. And a study from Massachusetts General Hospital found that adults over 65 who had cardiac edema for more than 8 weeks without evaluation had a 63% higher rate of sudden cardiac death within 2 years. The practical step is immediate. If your ankles are swelling symmetrically, if pressing your thumb into the skin leaves an indentation that takes more than a few seconds to fill back in, this is called pitting edema, and it requires medical evaluation this week, not next month. Synergy tip: reduce your sodium intake to under 1,500 milligrams per day immediately, as sodium is the primary driver of fluid retention that makes cardiac edema worse. A study from the American Heart Association found that this single dietary change reduced edema volume by an average of 31% within 1 week. It is never too late to get evaluated. Even if you have had ankle swelling for years, getting a proper cardiac assessment now can give your doctors the chance to intervene before a crisis occurs. Moving to number 4, the color signal in your ankles that most people completely ignore. Ankle swelling alone is one warning sign, but there is a second warning embedded in the appearance of the skin around your ankles and lower legs that is even more specific to vascular disease. Look at the skin on your lower legs right now. If it has taken on a brownish, reddish, or dark golden discoloration at the ankles that was not there 10 years ago, and if the skin in that area feels thickened or leathery compared to the skin higher on your leg, you may be looking at a condition called chronic venous insufficiency combined with hemosiderin deposits, and it has direct implications for your cardiac health. After the age of 65, your venous valves, the tiny one-way doors inside your leg veins that prevent blood from flowing backward, lose approximately 40% of their functional efficiency. Think of those valves like turnstiles at a subway station. When they work perfectly, everyone flows in one direction. When they wear out, the crowd starts moving backward. In your veins, that backward flow causes red blood cells to leak out of the vessel walls into the surrounding tissue. When those red blood cells break down, they leave behind an iron-containing pigment called hemosiderin. That is what creates the rust-colored staining on the lower leg. Researchers at Stanford University School of Medicine found that adults over 60 with visible hemosiderin staining on their lower legs had a 57% higher prevalence of concurrent coronary artery disease compared to those without the staining. The same venous dysfunction that causes the skin discoloration is often driven by the same systemic circulatory compromise that is affecting the heart. The practical step here is, again, evaluation. But in the meantime, elevating your legs above the level of your heart for 30 minutes twice daily has been shown in a study from the Cleveland Clinic to reduce venous pressure by an average of 40%. Synergy tip: wearing compression stockings rated at 15 to 20 millimeters of mercury during your waking hours has been shown to reduce venous blood pooling by 38%, directly reducing the severity of both the swelling and the skin changes. Meet Arthur, 69 years old, retired electrical engineer from Atlanta, Georgia. Arthur came to see me after his wife had been insisting for 2 years that the brownish discoloration around his ankles was not normal. He had been brushing her off for 2 years, telling her it was just sun damage, just aging skin. When I looked at his legs and ordered an echocardiogram, we found that his right ventricle was functioning at 62% of normal capacity. Arthur had moderate right-sided heart failure that had been silently progressing for years. The ankle color had been the flare gun his body was shooting into the sky, and nobody had been looking up. Within 6 months of treatment, Arthur's ejection fraction had improved to 78%. He told me his wife wept when she got the news. He told me he thinks about those 2 years sometimes, the 2 years he dismissed what his body was telling him. Arthur's doing well today. His wife bought him compression stockings for Christmas. It is never too late. Arthur proved that, even at 69, with years of undiagnosed dysfunction, intervention worked. Number 3, the vein pattern emergency. If you look at your feet and lower ankles and notice veins that appear prominently bluish-purple, that seem to bulge or twist visibly under the skin that you did not notice in your 40s, this is a warning that deserves immediate attention in combination with other symptoms. Visible varicosities alone are common and often benign, but in adults over 60, prominent new venous bulging in combination with ankle swelling, skin discoloration, or leg pain when walking represents a clinical picture called chronic venous disease with hemodynamic compromise, and it requires cardiac evaluation. After the age of 70, the risk of a condition called deep vein thrombosis, which is a blood clot forming in the deep veins of the leg, increases by approximately 270% compared to younger adults. A blood clot that breaks free and travels to the lungs, called a pulmonary embolism, is fatal in approximately 30% of untreated cases. And a study from Harvard Medical School found that adults over 65 with visible lower extremity varicosities combined with edema had a 420% higher risk of deep vein thrombosis compared to those without either finding. Implementation here is about risk reduction while you seek evaluation. Move your legs every 45 minutes if you are sitting for extended periods. Even 5 minutes of walking resets the venous pump mechanism in your calves. The calf muscles act as a secondary pump that assists the heart in moving blood back up from the legs. When those muscles are idle, blood pools. When they are active, blood moves. If this information is opening your eyes the way it has for so many people in this community, please take 1 second and hit that like button right now. And if you are not yet subscribed, please join us. I publish evidence-based health content specifically for people in their 60s, 70s, and beyond every single week. Subscribe and ring that bell so you never miss it. Number 2. The ankle warning sign almost everyone assumes is normal. Ankles that appear not swollen, not discolored, but thin and bony, with visibly prominent tendons and a loss of the soft tissue padding that used to fill in the sides and top of the foot. In adults over 60, loss of ankle tissue mass is one of the most under-recognized warning signs of cardiac cachexia, which is a form of muscle and tissue wasting driven by chronic heart failure. When the heart is chronically failing to pump efficiently, the body begins cannibalizing muscle tissue from the extremities to fuel vital organs. A study from the Journal of the American College of Cardiology found that adults over 65 with measurable ankle and lower leg muscle atrophy had a 72% higher rate of undiagnosed moderate to severe heart failure compared to age-matched controls without the finding. The body is sending a message through the shape of the ankles, a message that reads, "Something is consuming resources faster than I can replace them." After the age of 65, the combination of anabolic resistance and reduced cardiac output means that once this wasting process begins, it accelerates rapidly without intervention. A study from the European Journal of Heart Failure found that adults in cardiac cachexia lost an average of 11% of their total body muscle mass within 18 months. Practical implementation: increase your protein intake immediately. Aim for at least 1.2 grams of protein per kilogram of body weight daily, distributed across 3 meals rather than concentrated in one. Resistance exercise 2 to 3 times per week. Even light resistance maintains muscle tissue that cardiac cachexia is trying to consume. Synergy tip: L-carnitine, found abundantly in red meat and available as a supplement, has been shown in research from Stanford University to improve cardiac muscle function and reduce cachexia progression by 31% in adults over 60 with heart failure. And now, number 1, the ankle sign that is not a swelling sign at all, but a timing sign. The question that changes everything is not just what your ankles look like, it is when they look that way. Ankle swelling that is present and equal in both legs first thing in the morning before you have been on your feet for any length of time is the most urgent cardiac signal of all. In healthy veins, lying flat overnight allows fluid that accumulated during the day to drain back into circulation. Morning ankles should be at their thinnest, their most normal in appearance. When ankles are swollen before you even get out of bed, the heart has lost the ability to manage fluid even with the assistance of gravity working in its favor. This is a sign of decompensated heart failure, meaning the compensatory mechanisms have been overwhelmed. A study from Johns Hopkins University found that adults over 60 who reported morning ankle edema that had not resolved after 8 hours of lying flat were 94% more likely to be hospitalized for a cardiac event within 60 days compared to those whose edema was present only in the evening. This is not a wait-and-see sign. This is a call your doctor today sign. This is a go-to urgent care sign. Morning edema in both ankles that does not resolve overnight is a cardiac emergency in slow motion. The practical step is clear. Tonight, before bed, look at your ankles. Tomorrow morning, before you stand up, look at your ankles again. If there is swelling that is not drained away overnight, call your physician before you do anything else. I want to speak to you directly for a moment. Your heart has been with you every second of your life. It is beaten over 2 billion times without a day off, without asking anything in return. It gives you signs, subtle ones, quiet ones, signs written in the language of swelling and color and timing. You now have the ability to read those signs. It is never too late to pay attention. It is never too late to make a phone call that changes your future. It is never too late to listen to what your body has been trying to tell you. Whether you are 62 or 82, whether you have had heart problems before or never given your cardiovascular health a second thought, your heart is giving you information right now. The question is whether you are going to use it. Please share this video with someone you love, especially someone who has been brushing off ankle swelling or telling you it is just the heat. You could be giving them a conversation that saves their life. Leave me a comment right now telling me your age and whether you noticed anything in your ankles today while watching this. I will be right here reading every word you write. Subscribe, share, and hit the notification bell. I am Dr. William Lee, and I will see you in the next video. Take care of yourself. You are absolutely worth it. Before I close today, I want to address something that I hear from adults in this community constantly, which is the reluctance to bring up ankle swelling or any physical concern to a doctor for fear of being dismissed, told it is just aging, or sent home with advice to elevate your feet and come back in 3 months. That reluctance is understandable, and it is also potentially fatal. In cardiac medicine, the difference between catching a problem early and catching it in crisis is often measured in the quality and length of life itself. Here is what I want you to know about advocating for yourself in a medical appointment. You are entitled to say the following words. I have read that ankle swelling in adults over 60 can indicate cardiac dysfunction, and I would like a comprehensive cardiac evaluation, including an echocardiogram and a BNP level. BNP, or brain natriuretic peptide, is a blood test that is among the most sensitive available indicators of heart failure. It is a simple blood draw, it is covered by insurance, and it provides information about cardiac function that a general examination cannot. If your physician dismisses your concern without appropriate evaluation, you have every right to request a referral to a cardiologist. You are not being difficult. You are being your own best advocate. And in cardiovascular medicine, advocacy saves lives. A study from the American Heart Association found that adults over 60 who reported symptoms proactively and requested specific evaluations were diagnosed with cardiac conditions an average of 14 months earlier than those who waited to be asked about symptoms during routine visits. 14 months is an enormous window in cardiac disease progression. It is the difference between medication management and emergency intervention. It is the difference between independent life and hospitalization. I also want to mention that the 5 signs I described today are not intended to cause alarm, but to create clarity. If you looked at your ankles today and saw nothing concerning, that is genuinely good information. If you saw something that resonated with what I described, that is also good information because information in your hands is what drives early action. And early action is everything in heart health. Your heart has given you everything, every moment of love, every walk, every laugh, every opportunity to be present in your life has been delivered through 4 chambers of muscle that have not taken a single second off. Giving it your attention, giving it the evaluation it deserves, is the least it has earned. It is never too late to listen to your heart. Quite literally. One final thought I want to leave you with today, because it is relevant to every health warning video you will ever watch, including this one. The information I share is meant to complement your relationship with your physician, not replace it. The warning signs I described today are starting points for conversation, not definitive diagnoses. What you observe in your ankles tells you to pay attention, and seek evaluation. What your physician finds with the right diagnostic tools tells you what to do next. The collaboration between informed patients and attentive physicians produces dramatically better outcomes than either alone. You are not walking into your next appointment armed with internet anxiety. You are walking in armed with specific, evidence based vocabulary about what you have observed and what evaluation you are requesting. That is a different conversation, and it produces different results. Speak clearly, be specific, describe what you see and when you see it, and whether it has been changing. Your doctor needs your words to do their job well, and your words, sharpened by what you learned here today, are a clinical tool. To everyone who watched this video all the way through, I want to say something that I genuinely mean. Your willingness to seek out this information, to spend 30 minutes of your day learning about your health, is itself an act of self-care. Most people do not do it. Most people avoid thinking about cardiovascular risk until they are in a crisis. The fact that you are here, paying attention, taking notes, and planning to share this with someone you love, that matters. That is the kind of attention your heart deserves. Keep giving it that attention every single day. And remember, it is never too late to start paying attention. It is never too late to make the appointment. It is never too late to ask the question that leads to the answer that changes your life. Your heart is still beating right now. That means the opportunity to protect it is still open. Take it. Subscribe right now and share this video with someone you love. I am Dr. William Lee, and I will see you in the next video. Take care of yourself. Your heart has given you everything. Give it this in return.